It's believed to be a much neglected aspect of the country's gender-based violence scourge. Obstetric violence speaks to the abuse of pregnant women by healthcare professionals. Some women have spoken out about being assaulted, dragged on the floor to a labour bed, and even locked in bathrooms to give birth without assistance. Now, Jessica Rucell is from the Wits Centre for Applied Legal Studies. She's with the Gender Justice Unit there, and she's written a piece on obstetric violence. It says it's become a normalised phenomenon here in South Africa, and she joins me now from Cape Town. Jessica, thanks for your time this evening. Now, one could call it a silent scourge, but you point out in this piece that obstetric violence is evidenced by a body of academic and government research spanning 3 decades already. Why is our society so silent about this shameful abuse of women who are arguably at their most vulnerable and at the hands of the people who they need the most at that time?
Yes, it's quite an important issue. Thank you very much for having me on the program. South Africa is in an interesting position in this because it's something when you speak to women who are mothers or who have been pregnant, they will tell you about these experiences. You don't have to talk to too many mothers in order to hear about this kind of abuse and violence, which, as you've said already, spans physical violence, psychological abuse, as well as neglect and coercive medical interventions. And South Africa, it's important that here we're unique to many other countries that are dealing with this problem in that health professionals themselves, obstetricians and gynecologists, public health researchers, have pointed out this problem by researching it and writing about it for quite some time. So it is not only women themselves who have spoken out about this problem, but also health professionals have acknowledged it.
And now talk to me, you mentioned some of the different types of obstetric violence. Talk to me about those different types that women are experiencing, because I believe that some might not even know that they are being abused and what their rights are. I think specifically now about the incidents of coercive cesarean sections, which I know you believe have not been adequately investigated here in South Africa.
Yes, so obstetric violence, like other forms of gender-based violence, for example, domestic violence, are a result of gender inequality. And women from all racial backgrounds, classes, as well as geographic locations are vulnerable if they're seeking medical services in a health facility for pregnancy or childbirth. They're vulnerable to these kinds of abuses. And this is something that we know is not unique to South Africa. In 2014, the World Health Organization announced this and acknowledged it, that this is a problem across the globe. Now, specifically here in South Africa, what we've found is that the psychological abuse, the kind of implicit sex bias that is ingrained bias based on stereotypes of women, are really the most prevalent. At the same time, we find coercive sterilization, which has been in the news in the last few years, is also prevalent, especially amongst HIV-positive women in the country. Now, when we're talking about unnecessary kinds of medical interventions, we're talking about repeated unnecessary vaginal exams that happen during childbirth that are unnecessary for women, that women are describing as a form of sexual assault. We're also talking about unnecessary episiotomies, the cutting of the vagina during childbirth unnecessarily. The WHO has long, for many decades, acknowledged that a routine episiotomy, that kind of approach, has no clinical basis and is not in any of our guidelines. Yet that occurs, unnecessary cesarean sections also occur. South Africa, again, is not unique in this way, but we have had one of the very high rates of cesarean section and growing over the decades. Now, what we understand is that the reason for an unnecessary cesarean section, meaning there's no medical reason that a woman should not be able to have a vaginal birth, a normal birth, a so-called normal birth, because she's not at a high risk, the fetus is not at a high risk for childbirth. But we find that these unnecessary cesarean sections are happening, especially in the private sector. And why is that? Well, because the private sector can make more money. Insurance companies can make more money. Obstetricians can make more money because they can literally schedule your birth. Now, when you have a cesarean section, for example, it increases the risk of your pregnancy for yourself and your newborn. We're talking about serious risks of hemorrhage and complications. Now, we also understand that these coercive and forced sterilizations, which the Commission for Gender Equality has reported on, and the Department of Health has begun to respond to, happens when there's been a cesarean section. So when a woman has come in to the facility for a birth, for childbirth, and then they find themselves without a uterus afterwards because they've been coercively sterilized. So there are many kinds of unnecessary abuses. And the other thing that we have not mentioned yet is the neglect that happens, which is also, we've heard many, many reports across the provinces of neglect, where women go into the services and they are not being provided attention while they're in labor. And this, of course, also is a result of a lack of funding for women's health care, a lack of prioritization of women's health, which is also, I would argue, a result of a lack of gender equality in our healthcare budget.
And I suppose by extension, Jessica, there is probably also a lack of services being offered to these women after they've gone through these traumatic experiences as well, because that too is their right, to ensure that they can speak to somebody about the trauma that they've experienced, and of course perhaps even postpartum depression that comes as a result of it. But unfortunately we are running out of time, and I do need to ask you just one final question. You mentioned the health department saying that they are starting to respond to it, but this sounds more and more like a dirty little secret within the healthcare department. Why should we not be expecting to hear more from them? Should we be making more of a noise about it? And what is the problem at play within the department? Is it lack of education for the nurses and the healthcare workers that are the front-facing of these women who need them in their time of need when they're giving birth? Where is the problem, and why haven't we seen any movement on it?
Thank you so much for this very important solution-oriented question. This is what I've been most focused upon. So one of the problems is that the existing reporting system is arcane. It is not designed to actually support women, victims, people who are just accessing the public health services to report on the problems that they are facing. We need to have one hotline that actually accepts complaints and distributes them to the correct parties. But instead, we have an incredibly complex system of reporting that goes across multitudes of government and non-government institutions in order for a woman or her family to report what has happened. We're talking about issues that actually result in preventable deaths of newborns, of fetuses, and of mothers. This is of extreme importance, and the state needs to reform the reporting system that exists now. Now, when you ask me about what is the department doing and why, what is going on here, because this is something that even within the health community has been well established for some time, that we even have a lot of information now coming out since 2014 in the World Health Organization, noting this as a global problem of gender-based violence. Now, I must tell you that in 2020, we were hopeful when Minister Mkize appointed a committee led by Professor Sebi Trobani to investigate coercive sterilization of pregnant women and actually brought women who had been coercively sterilized to KZN for a meeting that was meant to begin the conversation of the investigation as well as restitution for those women. But we were disappointed when now Minister Falla in February abruptly announced that the investigation was closed and that women wouldn't actually be benefiting. So this is confusing, and there has been a lack of reporting in the media and by the department themselves around this. We don't have enough information about what the department is doing. Similarly, we were again interested to know when the Department of Women, Youth and Persons with Disabilities in January of this year announced that they were taking note of obstetric violence and they were working on how addressing it in some ways could be implemented to the National Strategic Plan on Gender-Based Violence and Femicide. But when we followed up with the Department of Women, there's no information as to who's heading that up or where it's going, and it's questionable about whether or not there has been any action. So what is necessary right now is really for the department to take this issue, and not only one department, but the state to take this issue seriously. This is a crisis in women's health, and women we have spoken to through our Know Your Rights program in over 5 provinces in rural and urban areas across the country. There is a lot of information that people have about this, and there have been many, countless reports of women being violated, but the state is not putting adequate consequence management into responding to this, and this needs to change.
Well, let's hope us having the conversation plants a few seeds in the right places as well, especially in homes where it needs to be discussed as well. That was Jessica Rucell from the Wits Centre for Applied Legal Studies. She's with their Gender Justice Unit. We thank her for her time on a very, very important subject matter tonight.